जी assalamu alaikum. My name is Dr. Falk, and today I'm going to explore the neck examination. Here you can see our doctor who's going to examine the neck, in which first of all you have to follow the command of ICE, which is the introduction to the patient, take a consent, informed consent, and then explore it. That place which you are going to examine, you have to explore it. After that, after exploring, but in this video our doctor is not exploring completely because of the privacy of the patient. So first he asks the patient, now there is a swelling in the right side of the neck region for last couple of months. After that he just inspect the swelling, overlying skin of the swelling, and in overlying skin of swelling there is no engorgement of the veins, there is no dilated vein or a scar mark or skin discoloration. After that he is asking the patient to raise the head, hands above the head, to see any respiratory discomfort, which is also called a abundance sign, which shows that if there is any caval obstruction which leads to the engorgement of the veins, so he excluded from that area. Then he is comparing the temperature after then getting the inspection and all the inspection at all the areas. Now he is comparing the temperature and the tenderness of the swelling. After that, confirming the temperature and tenderness, then he is now looking at the consistency, surface and the margin. As you can see, it is a firm to soft in consistency and with a well defined margins and a smooth surface. After getting all 3 points, then he is measuring the size of the swelling. Then after completing the measuring the size of swelling, now he is looking at the extension of the swelling. In between he has done the fixity of the swelling. Now he is looking the fixity of the swelling. He asking the patient to raise the head below the lateral aspect, and then he just went to see the mobility of the swelling. After completing it, there was a soft to firm in a consistency, so he has done the fluctuation, which shows somehow possible fluctuation. Now he is again looking at the fluctuation and that swelling, so he will do the trans elimination if there is a fluctuation. Now he is looking at the lymph nodes. There is the cervical lymph nodes. We all know that we have only 6 cervical lymph nodes: submental, mandibular and anterior and posterior cervical group with the supraclavicular groups. Now he is examining the left side of the cervical lymph nodes because the right side is not possible to do the examine because of the huge swelling. Now he asking patient to open the mouth to see any oral vision. That is called ENT examination, because the swelling is present at the neck region, so you have to complete the ENT also. But if the swelling is limited to the thyroid region and it is swelling arising from the thyroid, you don't need to do the ENT examination.